Thank you, Chairman Boss. And thank you for the very kind introduction, Congressman Courtney. I would also like to give a special shout out to Senator Richard Blumenthal, also from Connecticut. Chairman Boss, before I begin, with your permission, I would like to introduce a few very important people to me. Sons of the American Legion National Commander Joseph Navarrete of New Mexico. American Legion Auxiliary National President Trish Ward of Kansas. American Legion National Officers serving with me this year. And past National Commanders of the American Legion. And lastly, my incredible wife, Lisa. Chairman Boss, Ranking Member Takano, Chairman Moran, Ranking Member Blumenthal. On behalf of the nearly 3 million members of the American Legion family who proudly serve communities, states, and our nation every day, we deeply appreciate the opportunity to discuss our legislative priorities for the 119th Congress. Your distinguished committees focus almost exclusively on our nation's sacred obligation to ensure that veterans of the United States Armed Forces receive the best health care, disability benefits, and respect they deserve after their service. But what I want to put that obligation into a slightly different context. It begins with military service. We are all aware of the recruiting challenges our branches of service have faced in recent years. One frequently stated reason directly points to our work in support for veterans: a propensity to serve. Military service is an important commitment. A major part of the American Legion's purpose is to make sure that commitment provides worthwhile during and after time spent in uniform. Over the decades, the American Legion has fought to establish and provide continuous oversight for the Department of Veterans Affairs to ensure care for all who have borne the battle. We drafted and fought to pass the GI Bill and to improve it regularly over the years so it stays relevant for new generations, to empower those who served with opportunities to succeed. We created a network of trained, accredited service officers to represent veterans in matters with the VA, to ensure that veterans understand the laws that have been passed to help them with health care and disability benefits they earned and deserve. The American Legion demanded accountability for those who were sickened or died due to toxic exposure. And we worked to reduce any stigma associated with seeking mental health care. The American Legion believes that each one of us can and must be the one to help just one other veteran overcome suicide risk. Peer-to-peer support. Put simply, it's what we do. If we fail to live up to these important covenants, the thanks of a grateful nation to those who have sacrificed so much simply falls flat. Young people who have been told that military service will leave them broken or unsupported in the end will think twice about their propensity to serve at all. And that is a matter of national security. We need to change the narrative. We can change the narrative. Service in the United States Armed Forces is hard enough. That service should not create unnecessary hardships. We stand by federal efforts to create a more efficient, cost-effective VA. We must also look closely at connections that can be made better before discharge because they weigh heavily on life afterward. Among our legislation priorities, has been the case for many years, is completion and implementation of an electronic health records management system that documents deployment and medical history from the day of enlistment throughout a veteran's life. As Chairman Boss has stated, veterans are also taxpayers, and billions of our taxpayer dollars have been spent on this. The result has been delays, unsuccessful pilot programs, flawed infrastructure, and the continued inability of the Department of Defense and VA to make a transition seamless as possible for those leaving service and entering their lives as veterans. Another concern we hear continuously from the newest generation is the ineffectiveness of an outdated transition assistance program, also known as TAP. Members of the armed forces deserve the chance to convert their military training and skills into meaningful post-service careers. And that takes an effective, outcome-driven TAP program. A program that takes into account all the challenges of transition, from financial knowledge to career opportunity to mental health services. Otherwise, all that training and all those skills that the United States invested in these service members are left behind, when they could be helping drive the United States economy forward. Veterans left to confront difficult transitions without proper preparation are at risk for a number of bad outcomes, not the least of which is suicide. According to the VA's own research, veterans are most at risk for suicide in the first 12 months after discharge. Additional research has shown that financial strain accounts for 20% of the top 20 risk factors for suicide. A hard look at TAP, which needs to begin earlier for those nearing separation, can lead to a stronger model that will ease transition and advance the propensity to serve. Military service becomes more worthwhile pursue when the rewards in that service are valuable. Chairman Boss, there may be no greater incentive to serve in the United States Armed Forces than the GI Bill. There were 10 planks in the original GI Bill, not just free college tuition. Also included were health care, the ability to affordably purchase a home, business opportunities, and occupational training for the severely disabled so they could re-enter civilian life empowered with purpose. Many said the GI Bill would break the Treasury. In fact, it returns $7 for every taxpayer dollar invested. It built the American middle class, which our nation has enjoyed for over half a century and still enjoys today. And now, as we continue to seek congressional action to provide GI Bill parity for National Guard and Reserve veterans, we must ask, why wouldn't we? All we have is proof that it works. We can change the narrative about the outcomes of military service. We can change it with tangible steps, such as highly efficient VA healthcare and benefit systems that are easier to access and navigate, regardless of whether you live in a big city or in rural Kansas or Illinois, using telehealth, community providers, or traditional VA facilities. Mental health support without stigmatization and advance what we call post-traumatic growth to empower those so effective to not only recover, but to thrive. A TAP program and GI Bill that truly live up to the promises our nation has made to those who have chosen the path of military service. A propensity to serve simply means understanding the value of the commitment I and my fellow Legionnaires in this room have made. It's a lifelong commitment, and we are all proud of our service because we know America is worth it. We are duty-bound as veterans who believe in a strong America to do all we can to show that worth. In the American Legion, we don't just talk about these issues, we live them. So far, our academic partner, Columbia University, the American Legion have trained more than 12,000 people nationwide to identify risk for veteran suicide and take the right steps to prevent it through our Be the One mission. Last year, American Legion service officers helped more than 1.2 million veterans free of charge with their VA disability claims, resulted in $21 billion in awarded claims to veterans. Each year, the American Legion at the local, state, and national levels is involved with more than 1,100 career events to help veterans and families in transition. The American Legion family also spends millions of volunteer hours and donates billions of dollars annually to support VA facilities nationwide. We also mentor thousands of young people each year and award millions of dollars in scholarships to help them become productive, responsible citizens. And when natural disasters strike, from hurricanes in the Carolinas to wildfires in Los Angeles, our members leaned into harm's way and provide relief. American Legion family posts, squadrons, and units have been vital partners in recovery from disaster for over a century. Like you, we all took an oath to support and defend the Constitution of the United States of America. We work with our government of this great nation that pledged our lives to defend because we want to see America continue to prosper. On behalf of the nation's largest veteran service organization, I thank you for the opportunity to share these thoughts with you and look forward to working with this new Congress, especially as we draw nearer to the 250th anniversary of our great nation's independence. Chairman Boss, Chairman Moran, I thank you for the opportunity to address your critical committees, and I look forward to answering your questions you or other members may have. Thank you.